Greetings and warm welcome to our large audience from around the world and a great set of panelists and speakers to start this important summit on governing data for better health. My name is Shada Badi. I'm Managing Director of Open Data Watch and joining you from Washington, D.C., and I will be your moderator for this important summit today. I think we all know that COVID-19 pandemic has been a very tough teacher for us all. We learned that for good or for bad, we are all connected and need to act and work together to overcome crisis. We have also learned that data saves lives, but for it to save lives and improve lives, we need to govern it better. And data governance is the topic of this summit. And that means basically caring for data more as an asset and to get value from data, to care for it better along the data value chain, from steps when data is collected to dissemination and use. Today, we will hear from a number of data experts, users and data advocates, scientists, and very important researchers on subjects of health data. And big thanks to WHO for bringing this event together and gathering us all in a very inclusive way on this important topic to look for better governance of health data. It's going to be a journey and we all need to be part of this, and we need to fasten our seatbelts for WHO to lead us through this governance of better health data. Let me tell you a little bit about today's event. We will be joined, as I said, by a number of experts and panelists. We will have several segments. We will have opening section with keynote speak and welcoming remarks from important colleagues from WHO. Then we will have 3 panels. Panel 1 is going to be focusing on data for health data for global public good. Panel 2 is going to be focusing on country experiences, and we're going to hear from our country experts. And panel 3 is going to be bringing it together on some of the best practices. In between the 3 panels, each panel is going to have about 6 speakers, so we will have a large number of experts to go through. And in between the panels, we will have some videos and some special remarks. Some housekeepings for today. The event will be hosted, of course, in English, but those watching have also access to live translation into either Spanish or French. And you can use the interpretation function on the toolbar that you will see. There is a Q&A box for anyone who has questions. We have a team monitoring these questions and while the event is going, and we will try to address as many questions as we can get. Alternatively, please also post comments or thoughts into the chat box, and we would be collecting all those comments. As with all live events, we are relying on Wi-Fi and home internet. So if there are any technical difficulties, please bear with us, and we will be back online soon. So our first speaker I'm really glad to meet and introduce to you is Susanna Jakob, who is the Deputy Director General of WHO and a big advocate and a champion of health data. So over to you, Susanna, for getting us started.
Thank you very much, dear moderator, and thank you for moderating this session so ably. Dear Excellencies, colleagues, friends, ladies and gentlemen, welcome and thank you for joining us today at the Health Data Governance Summit. Special thanks to our country colleagues from Malawi, Zambia, Thailand to share their country experience, which is so important. Thank you also to the UN and to the partner organizations, as well as the vast research, academic, technology, and civil society contributors. And a special thanks to the frontline healthcare workers who are collecting, storing, sharing, and using data every day to make a measurable impact on people's lives. It truly takes the entire world to address data governance and unleash the potential of data as a global public good. The COVID-19 pandemic has shown that science and real-time data are indispensable. Together, they provide the evidence for strategic policy decisions. The challenge is ensuring this data is collected, stored, analyzed, shared, and used in a manner that assures transparency while also protecting the privacy of individuals for whom the data represents. WHO takes data governance very seriously, and we are constantly striving to gain clarity on this through a strong foundation of trust and collaboration with you. We have also established internal data governance mechanism as part of WHO's transformation agenda. And the role of Dr. Samira Asma, Assistant Director General, and her division has been instrumental in this work and in this progress. And without Samira's leadership, we would not have made progress in the last couple of years. And thank you, Samira, for that. Personally, data governance is close to my philosophy and experience as the regional director for WHO in the regional office for Europe in my previous life, where we had clearly defined systems to collect, store, and share data from and with the countries. This helped us to reduce the unnecessary reporting burden as per request from our member states and make the system efficient, transparent, and accountable. We also work together with partner institutions like the European Union to make sure that we coordinate the collection of data and don't put additional pressure on the member states to provide the same data several times. WHO is pleased to convene this first summit for three things. First, to provide an overview of the current health data landscape. Second, to make the case for health data being a global public good. And thirdly, to identify and promote the use of good practices for governing health data. This work is critical to track progress towards the 2030 SDG agenda, meet WHO's triple billion targets, and recover equitably from COVID-19 while being better prepared for the future. Ensuring real-time, reliable data is the most urgent priority of our time, and I thank you again for joining us today. We hope you can join us at our next session in September as well, and invite your inputs to our call for health data as a global public good. As a global public good, health data can have a positive impact on the lives of everyone, everywhere. It is now my pleasure to give the floor to John Pullinger. Thank you very much. Back to you.
Thank you, Susanna, for this very important opening remarks to get us started. I'm now going to turn to our keynote speaker, John Pullinger. John Pullinger is known to many of us. He's the president of International Association for Official Statistics and chair of the UK Electoral Commission and board member of the Global Partnership for Sustainable Development Data. In the circle that I am at Official Statistics, he's a rock star. And he's really a great champion and motivation behind development data excellence. So, John, virtual floor is yours. You have less than 10 minutes, I'm afraid.
Thank you very much, Shida, and thank you for that impressive introduction. I will try and live up to it. 7 years ago, the United Nations Secretary General was challenging us to embrace the data revolution in the World That Counts report. He saw that data was going to be central to the delivery of the 2030 Agenda for Sustainable Development. At that time, I was chair of the United Nations Statistical Commission, and I was going around making the connection between the world of data and the political drive around the SDGs. My message was that now is the time to step up, step forward, and step on the gas. Step up because people in the data world needed to realize their importance and be ready to play their essential role. Step forward because to be useful, data people needed to engage with the world of politics. Step on the gas because the clock was ticking fast and loud towards 2030. There was a music festival feel to it, maybe even the occasional rock star in the room. There were unusually boisterous, packed meetings at UNHQ in New York talking about statistics and data. There was an extraordinary event under the chandeliers of the Waldorf Astoria Hotel on Park Avenue to launch the new Global Partnership on Sustainable Development Data. Ministers, officials, civil society in all its diversity and vibrance, business leaders, as well as those of us from the statistics, data and tech community. There was an unforgettable evening on the rooftop terrace of Microsoft in Times Square, with people wandering around, rather alarmingly near the edge, in VR headsets. These events set the framework for each part of the data ecosystem to look at how to encourage the data revolution in their own region or sector. In the field of health, we launched the Health Data Collaborative. I was one of the speakers at the launch and can confirm the revolutionary festival feel carried through. And a lot has happened. There has been a mobilization of effort and a mobilization of data. The data revolution is becoming mainstream. We've shown that data really can be at the heart of our global mission to leave no one behind. But we've had a wake-up call in the last 18 months. Poor use of data and poor data governance has resulted in the deaths of many thousands of people. It's resulted in poor use of many billions of dollars. It's resulted in disadvantaged people falling even further behind. We have stepped up, but nowhere near enough. We have stepped forward, but not with the levels of confidence required. We have stepped on the gas, but now, with gas no longer an option due to climate change, we need to put booster chargers on our electronic vehicles. The revolutionaries of 2015 now need to take responsibility for mobilizing the power of data so that by 2030, no one is left behind. Taking responsibility means we have to think about governance and accountability. But hopefully we can still keep the passion going and energy that got the revolution off the ground in the first place. So what do we do next? First, we need to think about data as a global public good. It's not owned by the government, it's not owned by big business, and it's not owned by social media platforms. It's owned by each of us, the public, and its value grows the more it is shared and used. However, there's a problem. We, the public, get the argument about data use, but we're suspicious about our data being shared. We don't trust our governments, big business or social media organisations to do the right thing with it. We fear that they will sell it on, misuse it or lose it. There are too many stories of data being used against us without our knowledge or consent. We fear that data sharing means we'll give it to someone and they, rather than us, will get the benefit. We need what the World Bank has called, in its excellent 2021 World Development Report, which is focused entirely on the issue of data for better lives, a social contract for data. The social contract for data is about creating data governance that we can trust. It's about creating incentives to do the right thing with public data and sanctions for doing the wrong things. So what does this mean for health? It means creating a virtuous data cycle. The need for good data to save lives drives the creation of relevant and timely data products and services. The value of these products generates the necessary investment in data sources and data infrastructure, and this in turn encourages more use of data and more trust in it. The World Bank, through its Statistical Performance Indicators projects, has developed a methodology for measuring the performance of statistical and data systems to help drive up performance. And it's instructive but not altogether surprising to learn that the poorest have the furthest to go in mobilising the data they need for development. In the next phase, the global health community needs to nurture each stage in the data value chain, with a particular emphasis on how to support the poorest countries and communities. It starts with individuals. As members of our communities, we need to be shown that data benefits us by better decisions from our governments, better treatments for ourselves and our families, better research to make life better for our children, and better information so that we can see what's going on with health in our villages, towns, and cities. We need to see less misinformation about vaccines and conspiracies, less aggressive targeting by advertisers, less ignorance about what makes us healthy or unhealthy. When we see these things, we will be prepared to share more of our data. The primary points of health data collection are carers, nurses, and doctors. They need to be shown that collecting data is not a waste of time, not just another bit of bureaucracy that gets in the way of their caring responsibilities. That when they take the time to collect data, someone actually uses it to help their patients lead healthier lives. They need to hear the story of Florence Nightingale, the epitome of the medical statistician, whose 200th birthday we celebrated last year. Having been the lady of the lamp as a nurse in a terrifying war zone, Florence came back home to collate statistics on the war and use them to shine the bright light of data visualization. She revealed that poor sanitation and hygiene in the war zone hospitals was a much bigger killer of soldiers than the enemy. As a nurse, she saved many lives. As a nurse statistician, she convinced the powerful to change the entire hospital system to save the lives of millions. And it's not just carers, nurses, and doctors who need to get this memo. Hospital administrators need to see data as the means to drive up their own performance and develop systems for continuous improvement. They must be encouraged to see data as a tool that can help them learn how to do better, rather than a means by which they'll be blamed when things go wrong. Governments must see that data can be harnessed to help them make better decisions. They must learn how to be good users of data and wield the means to create real-time data systems that generate fast, detailed insights into the health of their populations. The data gaps that have caused so much anxiety during the COVID-19 pandemic need to be filled systematically if we're to avoid a repeat. The culture must shift to recognise that if countries share their data openly, the biggest beneficiary will be themselves. Free trade benefits all, but especially the free traders who learn the value of dynamic innovation. With the right safeguards, freely available health data benefits all, but especially those who share the most. They will benefit from the best research and insight. And the global community, especially the WHO, must take responsibility for creating the dialogue that will make all this happen, for bringing together all nations, for convening the world's experts, for bridging between governments, business, academia, and civil society, for engaging with privacy groups, ethical leaders, data scientists, and technologists. It is now up to you to learn the lessons of the COVID-19 pandemic. It's up to you to create a new global consensus on health data governance. It is up to you to make health data a global public good. I wish you every good fortune in your work. Thank you very much.
And thank you, John. Thank you for those important words and also reminding us of stepping up, stepping forward, and stepping on the gas, which is really has important meanings for this event today, the summit. Let's move on to our next segment, which is going to be by Samira Azma, Assistant Director General for Data Analytics and Delivery for Impact for WHO, and of course the co-host of today's event here. And Samira is going to help us put set the scene for the summit and the work going forward. Samira, over to you. You're muted, Samira.
Thank you, Shaida. And thank you, John, for bringing a laser focus So we up, forward, and with supersonic speed to advance this important work. Excellencies, dear colleagues and friends, thank you for joining us today. We are thrilled to see many of you taking the time to join us in a very important and timely conversation that will reinforce our collective commitment to good data governance, and not just data governance, as I learned from my colleague, Suit, who will be speaking to us today as well. We are delighted to have representation from our member states, partners, and policy drivers, experts, and many leading institutions from around the world. WHO truly appreciates your willingness to share your insights, experience, and guidance to make health data a global public health good. Good data governance is the foundation on which we establish trust, clarity, and confidence for effective data-driven policies. The topic of governance is complex and does not stop at data protection regulations or open data. It has many dimensions that include ethical and legal, societal, political, financial, technical, and with variations at global and national levels. Another point I would like to make is that data governance is often invisible, but when we do it right, the results are visible. It is possible to deliver impact with speed and at scale. For example, with good data governance, we can respond to any future health crisis with timely, informed decisions and get back on track towards achieving the 2030 agenda. It all boils down to saving lives and improving health for all. Today, I would like to update you on WHO's vision and our work in 3 specific areas. What's the state of health data globally, and the data principles and policies, and how we are operationalizing these through standards, structures, and solutions. Next slide, please. The current crisis has already exposed how many countries lack the data system to accurately gather, report, and use data for better health outcomes. The Score for Health Data Technical Package provides us an understanding on how precisely we can locate where the gaps are in each of the countries and what tools we have at our disposal to address them. It supports WHO's and partners' commitments to guide and support member states in the effective collection, analysis, reporting, and use of health data to achieve health-related SDGs and the triple billion targets. It is a technical package of 5 essential interventions to strengthen countries' data and health information capacity that includes, as you can see, surveys and CRVS, optimizing routine health information systems, reviewing the data and the policies, and finally enabling the use of data to drive impact. We released earlier this year the first global assessment from 133 countries. And the results of these analysis, I give some few examples. What we found is 4 in 10 deaths worldwide remain unregistered. And this number rises to a staggering 9 in 10 in the African region. This blind spot existed before COVID, but has been accentuated by the pandemic. Now we are relying on guesstimates and estimates to count people who we are losing due to the pandemic. And without knowing how and when people die and what they die of in the present, how can we even hope to save lives in the future? In addition, what we found is less than 50% of countries have the ability to report on disaggregated data. And then when we want to keep equity at the center of what we do, it is hard without having the right data on the people that we think should not be left behind and shouldn't be left behind. And finally, the report also indicated that less than 50% of countries have open data policies or data sharing policies. So here we have a foundation. We know where the problems are, and we know what the solutions are that need to be directed at closing the gaps. Next slide. We have made some progress and established 5 distinct data principles at WHO to govern our work. And these define the values and standards on how we govern the data flow from the member states within WHO and out of WHO. In other words, how data is collected, processed, shared, and used. And these principles are very important. We treat data as a public good. We uphold member states' trust in data, support member states' data and health information systems capacity, and be a responsible data steward and a manager, because we have been given the trust by our member states. And we strive to fill public health data gaps by strengthening the capacity of the countries. And this is what countries have requested of WHO, and WHO can't do it alone. We can only be successful together in partnership. We also have 2 data sharing policies at WHO, one during the time of non-emergencies and the other during emergency situations. And we are moving forward to see how we operationalize it. And today's summit and your insights will truly inform how we best operationalize these principles and policies. Next slide, very quickly, is we are committed now to convene all our partners and global stakeholders and member states to have a dialogue like we are having at this one, so that we can have a shared partnership built on trust, transparency, and teamwork. As Dr. Tedros has said, one of the defining characteristics of the pandemic has been lack of sharing of scientific evidence, of resources, of vaccines, and crucially, of data. The challenge is ensuring that increasing amounts of data in various forms, from research to clinical trials, public health surveillance, the private sector, and more, is collected, analyzed, shared, and used transparently while protecting individual privacy. And our job at the international level is to remove the persisting barriers of data sharing through dialogue and collaboration. And at the foundation of this work is trust that we share. We are investing as part of WHO's transformation and Dr. Tedros's vision in resources like the SCORE technical package. We are also have embarked on the World Health Data Hub, making the enterprise of health data as modern as possible. So we are using real-time, transparent, reliable, actionable, disaggregated, accessible data so everyone can benefit. So we look forward to your exchanges and how you can give us the guidance as we take this work forward. And this has been truly a crisis, and we must, as John has said, find the solutions and move forward. So thank you very much. Look forward to listening to you and learning from you. Over to you, Shaida.
Thank you. Thanks, dear Samira, and thanks for this really motivational speak on what you have done. I've been watching for the past year or so your progress and setting the principles and the SCORE framework for monitoring, and of course your data sharing principles, and now working on the hub is just amazing progress and bringing us together to help you with the governance. So we're really impressed with what WHO and you have achieved, and our congratulations, and going forward, and keep up the energy going forward. Now let's turn into our panel one. We're running a little bit behind schedule, but we'll try to catch up with an excellent panel ahead of us. I just wanted to mention that during the registration and with the great participation from the audience, a number of questions were submitted, and we have been collecting those questions and looking at sort of the patterns of the type of questions that the audience would like us to cover in this panel. And you will see a word cloud somewhere on the screen that would actually show that. So the sort of the depicting some of the keywords that has been used in the various questions that we have received. Now we have about 30 minutes, and we have 6 panelists, and I just wanted to introduce them very quickly to you and get going with the discussions. We have Sarah Levington with us, and Sarah is the professor of epidemiology and medical statistics at the Oxford University. And then we have Mila Romanoff, and Mila is the data governance lead and privacy specialist of UN Global Pulse in the Executive Office of the UN Secretary General. We have my dear colleague and friend Johannes Juding, and he's the executive head of the Partnership in Statistics for Development in the 21st Century, otherwise known as Paris 21, and a global data partnership, which is a global data partnership hosted in OECD. And then we have Steve McFeely, and Steve is the chief statistician at UNCTAD and co-chair of the Committee of Chief Statisticians of the UN system. And I think it's no secret that he's about to join WHO as the incoming director of data analytics. And then we have Angie Day Andili, and Angie Day is the commissioner on the Lancet and Financial Times Global Commission for Governing Health Futures 2030. And then finally, last but not least, we have our dear friend and colleague, Don Joliffe, who is the lead economist and the co-director for this year's World Development Report, Data for Better Lives. So let's get started. I'll start with you, Sarah, with a question that you're a professor at the university and very much, of course, looking at data and research. The question that I have for you is, why should data be treated as a global public good? The global public good is, of course, the topic of this panel. And can you tell us a little more about your data sharing efforts, particularly in biobanks and having researchers collaborate ultimately for better health outcome? Sarah, over to you. You have less than 4 minutes.
Thank 4 minutes. Okay, thank you very much, Shada. Well, I think we can all agree that data are at the heart of population health research, and we've already heard today the ongoing pandemic has really accentuated the benefits and the need for high quality and high impact data that are timely, reliable, transparent and actionable. So the work I do is with large-scale observational studies, and those with biospecimens known as biobanks. And these studies have helped identify many of the major causes of premature death and disability. But the effects of these factors vary greatly from one population to another, and it's still uncertain really quite how important these factors are in different settings, and also how their importance might change over time. Also, unfortunately, most of our data on these factors comes from high-income countries. And so the current global estimates used by organisations like the World Health Organization depend mainly on mathematical extrapolations of these findings from high-income countries. And so acquiring direct evidence from low and middle-income countries is essential. So today I'm just going to talk briefly about our experiences in Oxford of conducting large-scale epidemiological studies and coordinating collaborative meta-analyses of these studies, focusing on some of the challenges, but also on the rewards of these exercises. So these studies and meta-analyses are a huge team effort, requiring collaboration between researchers and support staff in Oxford and internationally The collaborations are built on transparency, trust and respect, and making sure that everyone receives appropriate reward for their contribution to the studies and to the meta-analyses. And I think it is these words, collaboration, transparency, trust, respect, reward, that are absolutely key to successful health research and data sharing. You know, for example, all of our international studies have locally based principal investigators, and we all work closely to make sure that the studies run successfully and adhere both to local and international requirements. Of course, each of these collaborations works slightly differently depending on local circumstances and requirements, but in all cases, we're equal partners, and the success of these studies depends on recognising, respecting and capitalising on our different but complementary strengths. I don't think I can emphasise enough how much hard work is required by so many people over so many years and decades to ensure the success of large prospective studies and to ensure that we have the data available to determine these major causes of death and disability. So I'm just going to talk now a bit about open access data versus data sharing, because I think there's an important distinction. And there are two models really that are developing for prospective studies. There are studies that are initiated as an open access resource, and the examples of these would be the very successful UK Biobank study and the All of Us study in the US. But these studies come with all the necessary financial and institutional support that entails. And I would say this is increasingly the favoured model in high-income countries. And then we have studies that are initiated locally by a dedicated small team, usually with very limited resources. And this is the usual model in the low and middle income countries. Now, the benefits of data sharing are obvious, but if we want available global data, then we need to incentivize and reward people for generating those data. They must not be just data generators for data researchers from wealthy high-income countries. We need to make sure that the people who establish these studies and spend decades of their lives developing the resources reap the benefits. And importantly, of course, we also need to make sure that the participants in the studies trust those generating and sharing the data. So I coordinate the Richard Dole Consortium, and through this consortium, we aim to facilitate collaboration between researchers conducting large-scale observational studies in different parts of the world, to promote data sharing, to improve our understanding of the major modifiable causes of premature death and disability in the different populations, and also importantly to strengthen research capacity in those low and middle income countries to conduct the large-scale observational studies. And of course, the ultimate aim of all this, of population health research and data sharing, should be to produce reliable estimates of the major causes of premature death and disability with which to inform public health policies.
Thank you. Thanks very much for those comments. And I wish I could repeat them as a moderator, but we are in such a short of time that I'm just going to move on to the next speaker, Mila. Mila, you're working at the global UN Global Pulse and very much involved with the UN Secretary General's data strategy. I was wondering if you could tell us a little bit about how this data strategy could actually support the agenda of the better health outcomes and better governance for better health outcomes. If you could wrap that up in 4 minutes, I would really appreciate that. Thanks, Mila. Over to you.
Thank you, Shada, and thank you very much to the organizers and inviting UN Global Pulse to participate today. I will try to be very brief. Indeed, just last year, April 2020, the Secretary General has adopted the UN data strategy for action by everyone, everywhere, with insight, impact, and integrity. Just prior to that, in June of 2019 and 2020, the Secretary General also established a panel, the high-level panel on digital cooperation, which came out also with the report and then the follow-up of the roadmap, which also highlighted the need to unlock the data and that and to ensure that the world benefits from the digital public goods. Global Pulse, as one of the co-champions of the high-level panel's recommendations, Recommendation 1B, specifically on digital public goods, has been promoting access to data for the past 3 years. But in how our entire work or existence, I would say, Global Pulse has been working to ensure access to data, particularly data that has been held, proprietary data that has been held by private sector. With the UN data strategy, the challenges kind of remained because we're talking about not only the data that the UN is collecting, but also the UN cooperating with non-UN stakeholders and benefiting from the data that's coming from outside of the UN. So when we speak about the UN data strategy and the experience of the UN Global Pulse that we bring to this space, is actually how do we unlock not only our data that the United Nations is collecting, but also the data that we're getting or can gain access to and can get the value from by partnering, by cooperating with non-UN stakeholders. And that concerns the private sector, of course, largely, but also civil society and, of course, academia. When we talk about data, we talk about data for everyone. We talk about the data that is governed properly. And the UN data strategy actually calls for ensuring that we have the right people and the right culture when we deal with data, that we make sure that we have proper data governance mechanisms and proper oversight for when such data is being used, whether it is internally or whether it is being shared and accessed through partnerships with other non-UN stakeholders. And we need to make sure that we also have proper technology that helps us process and actually use and make a valuable impact and insight out of the data that we are processing or using. So coming from my background of the data governance and the privacy specialist, I'll talk a little bit more on the mechanisms that we've been looking at and that ensure actually proper access to data. There are many mechanisms and actually challenges that still remain in today's world, and the prior speakers and the keynotes mentioned that even in the pandemic world, even within the last 18 months, we're still not there where we can freely or smoothly, I would say, not freely, smoothly gain access to data and use it to the benefit of the public to fight the pandemic. We were caught off guard with the COVID-19 crisis, but we need to make sure that in the future crises alike, we're more prepared. And data as well as technologies that help us to process this data need to be available. Now, when we say available, I do not mean that it needs to be freely available. And the previous speaker mentioned that indeed we need to make sure that it is sustainably available, that we have proper incentives, that all partners that cooperate in this field are actually willing to contribute the data, are willing to disclose what type of data they have, so that we can process it for proper information and improve the health services around the world. In order to do that, there were many initiatives already underway by WEF, by GPSDD, by the European Union. In fact, Global Pulse was also part of the expert group on business to government data sharing, which actually came out with the report last year as part of their EU data strategy on how to unlock the data held by private sector. So let me just elaborate on this a little bit. The mechanism—
Yeah, you have to wrap it up quicker, my dear. Thanks.
The mechanisms that currently exist to enable access to data are not functional yet. So we need to make sure that we're paying attention to data cooperatives, we're paying attention to data trusts, as well as pay attention to legal instruments like agreements and contracts. And this remains one of the biggest challenges when we talk about data access. It's actually legal aspects, not only technological aspects, but also legal aspects, where we need to have better and more flexible mechanisms to ensure privacy protective and ethical access to information. Thank you very much.
Thank you. Thanks, Mira. And I'm sorry I'm rushing everybody, but this is really flash presentation. So, and it doesn't mean you have to talk faster, but maybe, more just key points if you can. And again, I apologize. We are running behind schedule. Johannes, I'm coming to you with a very important question, but you have little time to answer, of course. But the question that I have is, why should from your perspective, helping countries to develop their statistical capacity, why should data be a global public good, and how can Paris 21 partnership contribute to this agenda? Over to you, Johannes. If you can wrap it up in 3-4 minutes, that would be terrific. Thank you.
Thank you very much, Shaida, for this kind introduction. Good afternoon, good morning. Great pleasure to be part of this important panel. Now, I will be really very brief because many important things have been said. So on your first point, global public good, health data as a global public good, I think we heard a lot of good arguments, convincing arguments why this should be the case. From an economic perspective, one of the key features of a global public good that it is non-rival, and it concerns everybody, all countries, all populations. And I think we heard trillions of examples from the crisis that this data is missing, that we lack good quality data. And that is not a surprise because it is a global public good. And according to any economic theory, they are underprovided. So I think we have a very strong argument and a very good understanding that we have a market failure here, which by nature leads not to enough protection of, in particular, I think the word quality is very important here. It's not about any kind of data, it's about quality data, it's about foundational data, in particular with respect to the health crisis and the pandemic. We have seen in conversations, and for statisticians, the crisis has been a curse and a blessing. A blessing because everybody wants to have data and is asking for evidence-based information. But on the other hand, there are huge gaps. So I think we can agree on the global public good part. Now, the more tricky question is, what can we do? What can we really do, and how can Paris 21 help? Of course, I can now count on 20 nice things, but I only focus on one. One is we need more and better funding. The whole ideas about data governance, good governance, and everything will only work in countries and internationally if we give the right resources. And if you look at serious estimations of colleagues here that have been mentioned, institutions, we need a doubling of aid, a doubling of current aid given to data and statistics to make that happen. And we need an increase in domestic resources. That's so critical. And the good news I wanted to share with you that there is a coalition of the willing, the BERN network on more and better funding for data, BERN network for more and better funding for data, which will launch a very important initiatives as the UN World Data Summit, which will be in October in Bern. So I really would like that these colleagues here, colleagues from the data side, from the health data side, join this effort, this international lobbying for more and better funding, and that this becomes part of the conversation in our attempt to make more resources available to do all the good things that we wanted to do. I stop here. I hope I made my point. Shaida, I saved you a couple of minutes. Hope you appreciate.
Thanks, Johannes. You actually came very strong with important message on the importance of financing. Let me move to Steve. Steve, you're the Chief Statistician at UNCTAD and co-chair of the Committee on the Chief Statisticians of the UN system. What are some of the advantages of data being a global public good from your perspective? And why do we need a strong data governance and a convention for better health outcome?
Thanks, Shaida. Good afternoon, good morning, everybody. The advantages are several, but I'd really like to focus on one, which is reducing inequality. This is a key ambition of Agenda 2030 and a central pillar of inclusive growth. As Johannes just pointed out, a public good means not only is it non-rivalous, but it's non-excludable as well, which in other words means we can all have this access to the same data at the same time. And that's key to reducing inequality for access to information, both for countries and for people. And I think this is crucial for development generally, but obviously, as we've seen in recent times, this is absolutely pivotally important for health. In an information era, in the era of the data revolution, we have to avoid creating a new dimension of inequality, or the data haves and the data have-nots. This is a very simple but a very fundamental argument for securing data as a global public good. We need to avoid the data neocolonialism where developing countries are supplying data but don't benefit from the analysis or the use of that data. Back in 2014, when member states signed up to the fundamental principles of official statistics, in Principle 1, they were explicitly signaling the importance of official statistics as a public good. But this argument should not be limited to official statistics only. For example, this is why we see our own open data movement. It's why we see the UN Secretary General highlighting the importance of data as a public good in his data strategy. Free access to data and information in the context of global public health is of central importance. How can we expect to control the spread of disease or manage or improve health systems without sharing and analyzing data? How do we combat vaccine hesitancy without presenting facts? Back in 1854, John Snow did pioneering work on the spread of cholera, both in England and London. That message spread by sharing that information, by sharing that data. And I think Sarah outlined clearly 170 years later, while the same message hasn't changed, like the sharing of information is absolutely pivotal. So let me wrap up by just saying something very quickly about governance, or what the World Bank, as we've heard, is called the social contract for data. This social contract plays a vital role. There are many types of data, many types of data products. Some are mundane, others are extremely sensitive. So not all data could or should be public goods. So there's ethical considerations, there's privacy considerations. So good governance is central to ensure that data that should remain confidential, for example, are protected. But also good governance is there to ensure that data that should be public can be open. So good governance is central to reassuring that the public, the data providers, that their data will be treated with the respect that the data deserve, that promises we made to them as data collectors are kept, and that we will not use or share their data in ways that we promised that we wouldn't, either in normal or in emergency situations. So in fact, good governance is crucial to the maximization of data availability and access. Thanks, Shada.
Thank you. Thanks, Steve. That's tremendously important. I wish I could make a poster out of what you just said. That's really, thank you for that. Let's move to you, Njide. And the question that I have for you is, if data is a global public good, how can this lead to equitable health outcomes? And what needs to happen to bring data, digital health, and public-private communities together? Njide, you have less than 4 minutes, I'm afraid. Thank you. Over to you.
Thank you so much for having me. First of all, I want to just mention that the Lancet and Financial Times was established to explore how we can use digital technology and artificial intelligence to accelerate UHC by 2030. Everybody's been talking about how the world can cover its population, but no health system can exist without health data. In fact, arguably, health data is really fundamental, and especially for developing countries, African countries, where the health systems are not strong enough. And in doing this, what the Commission has been doing, there are about 18 of us that have been working over the last 2 years, looking at different models, looking at all the different areas of the use of health data, and the governance around that. Is it individual versus societal? How does it help achieve health equity? And in exploring that, we've been looking at data solidarity and how, while protecting individual rights, we can make this data available so that we can promote health equity, which is really important. If we don't know who is covered, if we don't know what the disease ailments are, how do we design a system that can cater for all the population around the world? So health data really is a key driver for health equity. And again, in accordance to, really trying to achieve this equity and have a meaningful distribution of healthcare around the world, we need to know exactly Who are the individuals, the communities? And what we're finding is that there has to be some kind of decentralization when it comes to governance. We have to take into account the peculiarities within the communities, and also recognizing that there's a lot of aid, moving around the world. That coming to Africa, for example, there's a lot of donor funding coming in, and the way it's designed, the donors own the data and they do with the data as they please. So what are the governance structures around that can help ensure equity? So these are some of the things that, data being a public good and the governance around that has to critically look at. And it's important to also mention that with the work of the Commission, we've been trying to bring different stakeholders together. For example, we're working with Transform Health Coalition and young experts and other partners to develop a set of principles. And these principles, it will be deliberated on sometime in the year. I think the date will be communicated. But again, it's something that WHO probably needs to look at. Luckily, we have Sumia as one of the commissioners. So we are really trying to make sure that as the world is going digital, exacerbated by COVID, and everybody is looking for a way to be connected to the healthcare system, how can we ensure there's proper governance around that to enable equity? Just to round up that, in Africa, for example, one of the key missing data, which is so fundamental to health access, is identification of individuals as human beings. We don't even know our population. People are migrating from east to west to north to south, but there's no documentation of the individuals. This again becomes critical when you need to access the healthcare system. So identification of the individual, the human being within the countries, within the communities is really critical. And we would actually categorize this as data essential for the healthcare system, and which, again, we need to put some governance around. So to round up, just to mention that we have to, as a society, find a platform to define the set of principles that would govern the sharing of healthcare data, to focus on data solidarity, maybe in a trust, and so that the owner of the data can give consent where and when that data will be used. But it's so critical now that we are becoming a more digital society. Back to you. I hope I saved some time for you.
Yes, absolutely. And what a great contribution. Thank you so much. And let me now turn to our last but very important speaker, Dean Jolie from the World Bank and the co-director of the World Development Report. Dean, my question for you is, listening to the other panelists and given this year's World Development Report focus on data, can you tell us a little bit more of how health data, being a global public good, can actually lead to stronger collaboration between health and non-health sectors for better data and better health outcome?
Hi, Shada. Yeah, thanks. Thanks so much for the question and the opportunity to participate today. So all of these questions that we're talking about, or everything we've talked about today, resonates really well with messages from the 2021 World Development Report. And to my ear, at least, one idea underpinning much of the discussion today is that we need to figure out ways to leverage greater value from data. So I'll comment on two big picture ideas we lobby for in the report: a call for this social contract for data and a focus on building better data systems. So in the report, we argue that too frequently data is collected for a single purpose, used once and then shelved. But a central attribute of data that others have noted is that using data once does not diminish the ability to use it again. It's completely reusable. Because data is frequently used once and filed away, much of the value of data to improve lives is then left untapped. So we need to find ways to get more value out of data, which means finding more ways to reuse, repurpose data to provide better insights to social concerns and unexpected problems. So greater reuse of data can simply mean allowing data to be used more than once, just for one purpose. That can be as straightforward as ensuring that data collected for some public intent, like improved public health outcomes, are made accessible to a wide array of users. So open data is really fundamental to leveraging greater value from data. But realizing greater value from data also requires getting data to flow more efficiently across users from different sectors and building bridges from one type of data to a different data source. And this is getting more directly at your question. When we think of most public health problems, it's rare that having data on just health status alone will provide an adequate information base to offer the right sort of or effective solutions. Most public health concerns are complex problems residing at the intersection of many socioeconomic issues such as education, income, social norms. And to find solutions, we need to be able to overlay these data on the health data. And so what that means is that we need to create systems that not only facilitate the flow of data to different users, but also create environments where one data source can be jointly used with another data source. So why would people be willing to participate in this call for collecting and sharing more data? What do they stand to gain from sharing data, and how can people trust that they and their data will be protected against harmful misuse of data? As John Pollinger noted in his keynote comments, the broad nature of these questions points to this need to get all of society to engage in dialogue around developing a social contract for data, essentially an agreement among all participants in the process of creating, sharing, and reusing data that fosters trust that they will not be harmed, that part of the value will be that part of the value created by data will accrue equitably. It's about agreeing on the rights governing data use. And so while the social contract provides a framework of rules for how data can be safely shared, realizing data's potential means that this framework must be built around a data system that not only ensures that safety, but really actively promotes the access to data. So the World Development Report offers an aspirational vision of an integrated national data system, which enhances data flows across different stakeholders, allowing all to benefit from data use and facilitating innovative new uses of data to solve existing and emerging problems. So really, these are the two big picture ideas for realizing greater value from data, is that countries across the world need to get society to engage in dialogue around this social contract for data. And this social contract should support the development of an integrated national data system that facilitates the creation and flow of data across all participants. Thanks, Shaida.
Thank you, Dean. Thanks. And thanks for the work you've done in the World Development Report. It's going to be really helping us with this journey of governing data and governing data for better health. We are out of time, but I'm really, really anxious to ask one more time, or going around with the panelists, to ask one 10-second question from everybody, that if you were to give one action item for this summit to take away, what would be that one action item? Give it the title of that action rather than describe it if you can. Can I start with you, Sarah?
Sure. I think from our point of view, if we want data from around the world, and particularly from the low-middle countries, I think we need to support the infrastructure required, develop, nurture an environment that encourages that data sharing and making sure that the people who do the hard work benefit, but also not forgetting, and this has come out, the individual people behind the data, and making sure that they trust in that principle of data sharing and appreciate the benefits of it and stop people being scared of data sharing.
Thank you. Thanks, Sarah. Mila, the title of your action would be action recommendation.
Cooperation between, for the summit to provide a stakeholder platform to discuss how to develop a framework that governs data access in the crisis and emergencies like today.
Thanks, Mila. Johannes, other than more financing.
Shaida, but it is. This summit should call for more and better funding to support data as a global public good in health and beyond. As simple as that.
Good. And Steve?
Hi, Shaida. Well, the chief statisticians of the international system have argued that we need a global data convention. And that's needed to protect the space for data for global public goods. And I think that this is crucial. This is how we find a balance between data as a commercial asset, a tradable asset, as a global public good, so we can facilitate data sharing. and yet strike a balance between business needs, between government and individual privacy. So I think, a global data convention will be central to better health outcomes.
Thanks, Steve. And GD,
So
what would be the title of your action?
It will be an inclusive process to develop a clear set of guidelines or principles to decentralize governance of digital data.
Absolutely. And Dean, you will have the last word, my dear. What would that be?
So when we met with governments that had been successful in transforming their societies in ways that use data more effectively to improve lives, the reasons they were successful really varied quite a bit from country to country. But an element that was really common across all the successful transformations was that they all had a handful of dynamic individuals who were champions for more effective and efficient use of data. So I'd lobby for us all to be champions for change.
Thank you, Dean. And thanks to all of you, Sarah, Mila, Johannes, Steve, and GD, and Dean, for making really a strong case for the health data as a global public good and your contribution. I'm sorry I had to rush you. I know you have so much more interesting things to share with the audience, but this was really a great panel. Thank you. Let me now turn to the next segment, which is a short video for us to see. It's a really strong video. I have looked at it that takes us to the frontline workers of health data workers and help us illustrate some of the underground data governance challenges that many of our countries and partners are facing. So let's.
Quality health data has the potential to transform billions of lives around the world. But before data is interpreted and policies implemented, the information needs to be gathered, stored, analyzed, and shared. Right now, health workers are tasked with gathering patient data on dozens of illnesses for different organizations and government departments. It's a complex and fragmented system that taxes the time and energy of frontline workers who are often already overworked.
Basically, the challenge is the manual way of doing things because it is a bit tiresome. We use these same healthcare workers who are delivering the services again to do the recording work. The world is moving digital. We need to invest in technology. This makes it less tedious for the health worker, and also we get real-time and updated data. This will help us now to make good and informed decisions pertaining maybe the disease trends, workload, the staffing needs, and all that.
It's a bit bulky right now. You see a nurse who is seeing the patients as well as filling booklets, and this can be a number of programs from HIV to malaria to tuberculosis. Challenges of having one person doing this, collecting the data, seeing the patients, making sure the data is accurate. So at some point, you tend to have some bit of discrepancies. When data is shared at different platforms, it creates the discussions. So it's something not to shy about, if you ask me personally. It's something we should embrace.
With unified data governance and better data sharing, the burden on essential frontline health workers can be reduced. At the same time, resource allocation and responses to disease outbreaks can be enhanced, thereby improving the lives of healthcare workers, patients, and communities across the globe.
Thank you. Thanks for this very important message from this video, which is a great segue actually to our next panel, where we would be focusing on on their country experiences. And let me just remind you again that we have been collecting a lot of amazing questions from the audience and from the people who have registered for this summit. And we now have a word cloud that actually depicts some of the key words that we have seen repeatedly in some of the questions. And I've tried to actually weave them into the question and integrate it in the question that you will hear from during this panel. This panel is going to be focusing very much on the country experiences, and we have 5 speakers that I will introduce very quickly. First, we have Glenda Gray. Glenda is the president and CEO of South Africa's Medical Research Council and non-executive director of Prenatal HIV Research Unit in Johannesburg. And then we have Welinga Musepa, who is the interim statistician general in Zambia's statistics agency. We have Suwit Wilbol Paul Cert with us, and he's the advisor, and very honored to have him with us, advisor to Thailand's Ministry of Health and vice chair of the International Health Policy Program Foundation, IHPF, among other important roles that he plays. And then we have Alan Malek, who is the executive director of Kenya Legal and Ethical Issues Network on HIV and AIDS. And then we have, of course, my dear colleague and friend, Mercy Kenyoka, who's a commissioner of statistics in Malawi's National Statistical Office. I would like to welcome the panel, and our focus today is really specific country challenges in governing health data and some suggestions for what needs to change. Let me start with you, Glenda, on looking at from the research perspective of what are some of the main challenges you face for governing research data and getting research data findings to influence health policy and programs and budgets for better health outcome.
Thank you very much.
If I could come to you for 4 minutes.
So thank you very much. I think that the COVID pandemic has taught us the importance of real-time data sharing and how important it is for researchers and scientists to share their data as quickly as possible, and as well as to work very hard with surveillance and people doing epidemiology. And in South Africa during the COVID-19 pandemic, all the scientists and epidemiologists and the people working with data shared freely and widely to try and do a response to the pandemic. And I think the most important evidence of this was the discovery of the Beta variant in South Africa and how quickly we were able to share that data and also share our resources. It wasn't just data sharing, but we actually shared biological samples and in vitro assays at a global level from South Africa to the US to Europe and vice versa. So material transfer agreements and data sharing were critical. And the importance of data sharing has also been evident as we've seen the rapid emergence of the variant of concern from the Beta variant to the Delta variant in South Africa. And if there's no data sharing in South Africa, we would not have had real-time access to the changing of the variants of concern. But of course, it's also very important as scientists in South Africa or scientists from the global south to try and understand how we muster up our power in terms of data sharing. So we agree that we believe in non-exclusionary and non-rivalrous data sharing, but sometimes in research that's very difficult, and we see a kind of data apartheid arising and a lack of data equity. So scientists in the global south and particularly South Africa are very good at data collection and doing the groundwork to assimilate the important data that is needed for healthcare worker to support healthcare worker. But very often, because the scientists in South Africa are incredibly busy, we often don't have the time to synthesize and analyze and publish our data, and find ourselves in an unequal relationship with other people because of our inability to exploit the data that we have. And so any data that involves data collection, then we have to find a way of empowering, capacitating researchers from the global south to do this. The South African Medical Research Council, as a publicly funded entity, is deeply committed to open access. And we have ensured that everyone who gets money from our organization through the public purse has to commit to data access and data sharing in a way to try and develop equity. But at the same time, many of our scientists feel disempowered because giving your data out to other people means that there's less chance for you to publish. We've also spent a lot of time trying to understand the importance of knowledge translation. So it's not just important for our scientists just to accumulate data and write up their papers, but we also have to be committed to translating that knowledge into practice and implementation. And that's the next challenge in South Africa, is how do we take the knowledge the public purse has paid for to make sure that we can translate that into practice. Because if we don't translate it into practice, then we have wasted the resources that we have for funding. So I look very forward to looking at the way we can have more equity, less apartheid, more sharing, more capacity development, and more support for those people who collect data, to support them to translate it into knowledge that will help and save lives. So I'm going to finish there by just saying we're deeply committed to open access, and we're also deeply committed to making sure that our scientists also can benefit from data sharing, and that we have shared data, and we will continue to do it, and hopefully we can build capacity in that way. Thank you very much.
Thank you. Thanks, Glenda. And thanks for really important points on data equity and link to open data and open research data. Thanks for mentioning that. And I'll come back to you with your second question at the end if we have time. But I love to listen to you longer. Let's move now to Malenga. Malenga, you're the interim statistician general in Zambia's statistical office. What are some of the main data governance challenges that you face in Zambia, getting data from collection to use and influencing policies? Malenga, you have less than 4 minutes. Over to you.
Thank you very much. I'll try to do it in less than 4 minutes. I think for a country like Zambia, like most of the developing world, I think the starting point is basically the appreciation of the role of statistics in the development of a country. I did hear a colleague from the World Bank who spoke about funding. But what drives funding? Funding will be driven by various leadership understanding that statistics are important in the development. Statistics are important in saving lives. Short of that, you'll find that all the various sub-challenges that you have, including in the health sector, will not be attended to. Now, and that means that I think for a country like Zambia, what we've started doing is statistical advocacy, to make from the highest office in the land understand that for you to develop, for you to foresee, for you to be able to be effective in whatever you are doing in whichever sector, including health, you need to appreciate the role of statistics. And therefore, our idea is to establish a knowledge society. And what we're doing at the moment is, another colleague talked about an integrated national statistical system. We are developing a national strategy for development of statistics, which will be included in the National Development Plan. And included there is the health sector, where the health sector will now generate, in fact, have generated sector-specific statistics plan that they have to follow over a period of time. Now, what those plans show, they kind of try and address the various challenges that you have in the health sector. In fact, our act also of 2018, we worked with Paris 21 in developing the NSDS. Our act also emphasizes 3 things: production, understanding, and promoting the use of statistics, because that's where the issue is. We've identified that there's a gap between dissemination and uptake. And from time to time, what you see is that you see a lot of people are out there, they disseminate very, very good findings. The next thing is how many people are using those statistics. One of the things I can actually tell you, every time I'm doing my monthly statistic dissemination, I try to find out how many of the policymakers are listening to me. Because if I do not have any of the policymakers listening to me, then how do you expect them to listen to me when I'm asking for money for funding? And therefore, what I began with, first, to make sure at every level, leadership levels, ownership, commitment, appreciation, and understanding of the role of statistics in development. Once that is done, and you call it a public good, can we make statistics be a public good? Like the World Bank last time said, in Africa, one of the problems that is infrastructure. So you need to develop infrastructure. It's a public good. It will help you to develop. Can you also make health to be at the same level? Then you will see the policymakers who actually pay attention to resolving the issues, especially in developing world, resolving the issues to do with financing, human resource, technical challenges, even the digital world. Yes, the digital world is out there, but what justification do you have to convince the funders, the policymakers, to actually fund digital? So I think the most important thing I would want to say is first and foremost to try and create a knowledge society, a society where decisions are made based on strong statistical foundation.
Thank you. Thanks, Malenga. And that is really, really important because you're talking about how to create a virtuous cycle for data and create demand, which actually increases the support for data in turn. So thanks for that very powerful message. Suet, I'm now turning to you. You have been a long-standing advisor to Thailand's Ministry of Health, and you've had very important roles that you have played. What are some of the main data governance challenges that you have seen in Thailand and in your experience, and getting data from collection to use to influencing policy? Over to you, Suet, for 4 minutes.
Thank you, Shada. I would start with a few stories. When we want to monitor the progress of the national antimicrobial resistance target, one of the targets is to improve the awareness and perception of the people in using antimicrobial. We don't have that data, basic data. So we went to the National Statistical Office and talked to them whether they can add a few questions into their National Health and Welfare Survey every 2 years. They didn't have any hesitation to work with us, and we got the data. Why? How? Because we have been working with them for decades, and they trust us. They know us. They know that we are reliable. They know that we are credible. They know us by person. We know them by person. And they know that we are working for public interest, not self-interest. At the same time, we also want to monitor the antimicrobial consumption. We went to the FDA because the database is there. We don't know well the staff who hold the data. We went to the Secretary General, and the Secretary General committed and instructed his staff to join, to collaborate. But we have huge difficulties in getting the data because they don't trust us. Even with top-level instruction, we have difficulties. And we soon learn later on that one of their difficulties is that they know damn well that their database has many challenges in it. And then we gradually convince them to collect or revise those databases so that we can use. Gradually build trust. I think most of the speakers talk about trust in the governing structure. Trust has to be built now, not wait in the future, or not wait until you want to earn it from other people. Here in Thailand, we believe in multiple governance system for data governance. Governance by state, existing, not very efficient, bureaucratic. Governance by market, difficult to control. Everywhere, market control data. Believe more in governance by networking, based on trust. We also don't believe in the free flow of information or data. Nothing is good if it is free flow. Even free trade is not free flow of goods, service, labor, or finance. Always selective flow. Any human cells or animal cells or plant cells that allow free flow of elements, ions, anything, bacteria, microbes, into and out of the cell, it will soon die. It cannot exist. So my last point to you is that trust takes time to build, second to break, and lifetime to rebuild. Start building trust now for the foundation of good data governance in your country. Thank you.
Thank you, and thanks so much for that strong message on trust as the foundation for good data governance. And we absolutely heard that and take it to heart. Now let's move to Alan Malik, and we're very interested in Kenya, of course, in terms of law, ethics, and rights-based approach to data governance. My question for you is, what are some of the main data governance challenges or advancements that you have made, and sort of needs, particularly in terms of needs of communities that are left behind and are being accountable to, there's an accountability to those communities? Over to you, Alan, for less than 4 minutes, if you could.
Thank you, Shaida, and I'll definitely do it below 4 minutes because the previous speaker from Thailand, Suwit, has really made the most important point that relates to communities that we work with, building trust. And I think the first challenge we have faced as people who work with communities is the lack of inclusiveness of all communities. We have witnessed situations where certain data, especially in the HIV field, for certain groups of people, such as men who have sex with men, sex workers, drug users, or transgender persons, is not collected. And when data is not collected, as Mulenga said, it's then impossible to budget, it's then impossible to claim for funds. And in the case of HIV, it's extremely difficult to get life-saving services for people who are left out. So inclusivity is an important principle to ensure that you don't leave any community behind, be it their refugee status, be it their sexual orientation, be it their HIV status, or be it their age. That is an extremely important aspect that needs to be taken into account. I think the second and most important thing is the actual involvement of the affected communities. Many a times we see that people think about communities or the people they collect data from as an afterthought. I think it's high time we began prioritizing to put people who are affected on the onset of any health data project that we are taking forward and how we are collecting their data. Thirdly, the issue of transparency and accountability of health data is extremely critical. We've seen this not only at the national level, but also at the global level, where either certain global institutions, government institutions, are not very transparent with what they do with the data they collect, who owns the data, and how that is taken forward. And that transparency is extremely important. And I think the last point I'll make is the absence of strong legal and policy frameworks to safeguard data and to ensure that people are held accountable in case of data breaches, and also people are held accountable in terms of how they are utilizing our health data. I think one example that's extremely stark for me is during this COVID period, we have had challenges in tracking many governments on how they have spent their money on COVID, and this is actually money going towards health. So with some level of transparency, with a strong legal and policy framework, and hopefully globally, given WHO is on this call, having unified principles around how should private sector, civil society, governments all operate would be extremely important. And just to buttress the point raised by Dee, that as a member of Transform Health, there are principles being developed, and I hope we will have a chance to engage with different stakeholders and eventually have a globally accepted principles and standards that people can use to collect data, to use data, and to actually make sure it is meaningful and it involves communities. Over to you, Shaida.
Thank you. Thanks, Alan, for very important messages and based on your experience in Kenya. Really appreciate that. I now turn to Mercy. We look to Mercy for experience from Malawi on data driving better health outcomes. And my question for you is, what are some of the main data governance challenges that you face in Malawi, getting data from collection to use for influencing health policy programs and budget? Over to you, Mercy, for 4 minutes.
Thank you very much. And thank you for inviting me to be on this panel. National Statistical Office operates a common service. We are in government, but we also operate a common service. And what do I mean by common service? With statisticians, we do second statisticians to ministries. So in the case of Ministry of Health, we do second statisticians to various cadres in the Ministry of Health. At headquarters, district health office, even every district health facility has got a statistical clerk who does the data collection. So that's on the positive part. The challenge we have is on a capacity building. These people have to be trained, especially the lower cadres of statistical clerks. They need to be trained so that data is not lost. There was an experience we had sometime last year where we actually lost the whole database. And we had to, the ministry had to make arrangements to have the data captured again. So that was we lost the resources, obviously. So we need to build capacity in the health personnel. But this is in addition to, I'm just concentrating on the activities of the Ministry of Health. These are in addition to the DHA surveys, which the National Statistical Office conduct, mixed surveys, and even population housing census surveys, which these are household-based surveys. So that's one challenge, capacity building. The other challenge, which to me is more critical, in addition, but is just as important, is the issue of coordination. When you look at data, health data, there is excellent data on HIV and AIDS because it's program-based. And the donors, with Global Fund and so on, which is really supporting that. And even when you look at malaria programs, TB programs, those are donor-funded programs and they are adequately resourced. So what we need is coordination so that we can optimally allocate these resources. So for the good of the whole framework of data, health data. So we really need to rationalize those resources so that they can be coordinated, they can be properly integrated, so that we don't have these silos where we have excellent data in one area and we don't have data in the other area. So coordination is critical and integration is quite also critical. Thank you very much.
Thank you, Mercy, and really important points of on-the-ground experience from you on the importance of data coordination and collaboration. We are coming to the end of this panel, but I'm going to go around one more time to our panelists for one 30-second response on what would be one important action item or important message that you want to really pass on for the outcome of this summit from your perspective that needs to be included and taken into consideration for going forward with the data governance for health. Let's start with you, Glenda. Very 30-second message.
2 words: fairness and a value of trust.
Thank you. Over to you, Malenga.
Strong statistical advocacy alongside all initiatives to promote production, understanding, and use. Thank you.
Outstanding. Suet?
Well, I would say that we should strongly support those committed, trustworthy champions who work to link the health outcome and the data to establish a trust-based network governance by network. Thank you.
Thank you, Suet. I knew that trust is going to come to that recommendation. I'm glad it's there. Alan?
A meaningful involvement of communities from the onset in the collection and use of health data.
Amazing. And Mercy?
2 things. Coordination is important, but we should prioritize data so that we designate resources for data collection in all programs and let the statisticians be the one to collect the data and analyze it for health policy interventions. Thank you.
Thank you. And thanks to you all panelists and for being patient with me and for bringing such great knowledge and experience from your country and experiences. So thanks again. The next segment of the summit is going to be on a 10 minutes video break, which is going to be showing some really important listening to some of the data leaders on data governance from around the world. And I will be back with you right after this 10 minutes video break. Thank you.
The main challenge for governing health data is ensuring the systems for using this data are trustworthy from the perspective of citizens. Health data is fundamentally about people, and they have a stake in how it's used. If we want to realise the huge potential benefits of using health data, we have to build systems that are demonstrably worthy of the trust we're asking people to place in them. That includes meaningful transparency and embedding diverse public involvement into decision-making in a sustainable way.
Health data holds many promises of improving health outcomes and the delivery of health services, but it comes also with very significant challenges. I would summarize in 3 main challenges. The first one is about the privacy, security, sharing, and the use or misuse of health data. The second comes with a big issue related with bias in data. The fact that data sets, many times they come from high-income countries, many times white male populations, and we know today that about 80% of cardiovascular disease problems are actually in low and middle-income countries. And the third challenge is about the accuracy of data collection.
It's all about how you build capacity. Rules are not enough. It's passion and conviction and commitment that really make the difference. Capacity within your organization, but amongst us all. I can give an example, empowering governments to say no to systems that donors or others are selling to them if they're not suitable, if they're fragmenting, if they're over-engineered and so on. We all need the capacity to be able to make good decisions to govern data.
We need to ensure that regardless of its universality, different stakeholders are actually resonating with the local context and have control over their data, their health data. And they're taking into account the fact that governance is really rooted in the context.
The main challenge for governing health data is making sure that it is consistent across geographies and places, because it is important for our work to be able to compare like to like.
All too often, people are not consulted on the use and reuse of the data. And the lack of coordination, therefore, means that there's no common approach for accountability or clarity. With the lack of coordination, dialogue on how to address data challenges is fragmented, with limited learning across sectors and a failure to unite behind common norms, common values, and a collective ability to bring all voices to the debate, and therefore pushing policymakers for change.
One of the main challenges is to find appropriate funding for both the health system as well as the national data ecosystem.
The critical challenge in governing health data is ensuring equity in how data are accessed and used, especially in poverty-related diseases and settings where data processing resources are limited. Equity is possible when health workers, ministries, and researchers who collect data and the communities from whom data are collected are a part of the benefits of sharing and using the data. And there's lots of ways to do this which reduce barriers to access and strengthen the health impact of data use.
One critical challenge for governing health data is to ensure that data doesn't just end up populating centralized reports or dashboards, but also that it contributes effectively to continuous learning at all levels of the health system. And for this, health data need to be better oriented to the needs of health systems and communities that they serve. It needs to be presented in a form that's helpful for decision makers working at different levels of the health system, and it needs to be available when they need it.
Remember that we're actually data stewards. We're stewards that want to use the data effectively to gain insight, that we're trying to set up systems that allow it to be fairly shared, and that the benefit goes back to the people from whom that health data has been collected. So keeping that steward perspective means that we'll set up the right structure to balance fairness with gathering insight for really creating a global good.
I think good practices for governing health data have to influence the sort of pull and the push, the sort of beginning and the end of the process. So we want good practices in place to enable data to be shared and secondary analysis in the first place. And then we need to have good practices in place to make sure that how that data is used is responsible, accurate, and also whatever comes out gets back to the original organizations that gave the data in the first place.
To me, I think the good practice is bringing the people and stakeholders together to talk about their challenges. Not bringing them together won't bring us to any solution, but just opening a space, a safe space where the stakeholders can talk about their issues and concerns, and having a group process for addressing their challenges, I think will be one of the things we can do to make this work.
In Rwanda, they have done great work on that, where they have institutionalized routine meetings in every district every month for analyzing and discussing the data among all the representatives from all the facilities in the district and the communities in the district. And also they have a good practice on every month validating the data before these meetings, which are called the statistical meetings, data use meetings at the district level.
Well, for me, a good practice for governing health data is that it has to be at the same time holistic and based on universal principles. At the country level, it has to be holistic because health data do not stand by themselves. They are part of a much bigger statistical and data ecosystem containing demographic, social, economic information, and all of them have to be connected and integrated. And at the international level, we need to speak a common language based on universal principles so that the data of different countries meaningfully connect.
Our team at the Infectious Diseases Data Observatory, or EDO, has used an equity-driven model to develop data sharing platforms for emerging infections and poverty-related diseases. We involve those who collect the data in setting the research agenda for data use, in defining what data should be shared, and in being a part of the Data Access Committee to decide who has access to the data.
I think people underestimate the difficulty of the technical implementation of a data sharing infrastructure. That involves really developing common understanding of what data elements are, how they're stored, how they're defined, how data are protected as they move through the public health infrastructure, how they're protected from cybersecurity threats, which are increasing daily, so that we can assure that data retain their confidentiality. And then also, what infrastructure do we need to improve how people analyze data, how people visualize it, how they use it for more predictively, through improved analytics, through improved forecasting, through new technologies like artificial intelligence and machine learning.
A good practice for governing health data may be like the example we set up in France, a health data hub to gather health data and allow to project leaders to access to the identified health data via an extremely secure IT platform. And then they could pair and analyze all the data in compliance with citizens' rights.
A key resource for any researchers aspiring to conduct high-quality clinical research in low and middle-income countries is the eDCTP Knowledge Hub, which comprises the protocol development toolkit, the data management portal and data sharing toolkit. And this includes a recently released data and biospecimen governance document from a consultation that was launched by the Africa Academy of Sciences.
A good practice is to remain flexible and remember that one size doesn't fit all. Sometimes you can centralize the data and do the analysis centrally. Sometimes the data has to remain where it was collected, and then you have to distribute the analyses and then collect back together and aggregate the results. So the best practice is to remain flexible, to support the different use cases and data types, and that gives us the best chance to be able to combine data from different disciplines and work together.
I think the advent of access control databases and data use agreements for sharing health data that can't be made publicly available is a really positive step. And I'd like to encourage authors to consider using these sort of resources when they develop studies that involve human participants, so that they can ensure that their data is shared in accordance with their ethics committees and their funders' requirements long after the study is completed. But at the same time, the cost of using these can be quite high and their availability is far from universal. So I'd like to work as a community to ensure equitable access to these services, which could potentially also support greater diversity in the data that are contained within the databases, which would make them more valuable to drive new discoveries in the future.
Thank you for that excellent video of the different perspective that we heard on data governance. And welcome back to our audience. This is panel 3. And in this panel, we're going to be focusing on good practices in health governance from leading and hearing from leading institutions. I just wanted to remind you again that we have been collecting a number of questions, and there would be a word cloud that depicts some of the highlights of some of those questions, which we have tried to integrate into the question for the panelists. But we do have a wealth of knowledge from all the questions and comments that you are putting in the chat and the Q&A boxes today, and also from the questions you've submitted. So we are extremely thankful. We may not be able to answer any of all those questions, of course, but this is a very good way for collecting what your views are and what's really on your mind. We have, I think, 7 or 6 panelists today. Let me see if we have everyone here on board. Yes, good. And we are going to, I'm going to just quickly introduce our panelists and then we start the conversation. We have Archana Sharma from CERN, as she's the Senior Advisor for Relations with International Organizations and Principal Scientist. And really impressed that she's here. Really glad to have you, Archana. Then we have Kostas Glinos, who's the unit head of Open Science European Commission, with much experience in legal and policy drafting and implementation, especially on data sharing. It's really great to have Kostas with us. We have Anne-Josephine Flanagan, who's the World Economic Forum Data Policy and Governance Lead. And then we have Petra Wilson, the Managing Director, Health Connect Partners, and a WHO Digital Health Technical Advisory Group member. And then we have Rocio. I don't know if Rocio is with us. organizers could let me know, that would be great. I will introduce Rocio as soon as I see her on the screen, but I don't see her right now. And then we have Sebastian Maurer-Stroh, who's the Executive Director of Bioinformatics Informatics Institute at the Agency for Science, Technology and Research in Singapore. And we have Einar Bjorgo, who is the Director of Satellite Analysis and Applied Research at United Nations Institute for Training and Research, UNITAR, that we all know. So today we're going to hear from the perspectives from different, these experts that I just introduced, and we are looking for best practices from where they come from. I'm going to start with Archana from looking at a sort of a model for data governance and collaboration in research. And the question that I have for you is, from what good data and research governance practices do you think non-health sector entities such as CERN can contribute to governing health data for better health outcome? Archana, you have 4 minutes, please.
Thank you. Thank you very much for the question, Sheda. It's very relevant. However, as my colleague Tim Smith said, one size does not fit all. So we need to look at what is CERN, what does CERN bring? It is the largest laboratory for particles on the planet, and it continues to be a pioneer in pushing the frontiers for storing, sharing, and managing massive amounts of data over the last decades. And our flagship program at the Large Hadron Collider has resulted in a large body of experience with the so-called big data. Our management challenge, the data management challenge, which is whittled down data, peaks at 240 petabytes of data per year. And we are looking at managing exabytes and zettabytes, which is 1 trillion gigabytes imminently. That said, to facilitate our efforts, we would like now to also address challenges beyond particle physics that can be related to UN Sustained Development Goals. And for that, we need global partnerships and a little paradigm shift, so to speak, complementary to the academic freedom that we enjoy. We enjoy fair knowledge sharing, as you know, and publishing as well in this digital age. Nevertheless, CERN has been a pioneer in pushing the envelope in this direction as well, because we publish more than 100 peer-reviewed papers per year, per experiment, and share this work among the thousands of scientists who are working in these experiments. And what do? We really choose and seek patterns and trends in our data to push the scientific frontiers, like the Higgs boson, as all of you know, was discovered here. So how do we want to look to steer the path of correlating information trends and patterns in large data sets that can tackle real-life issues? I can give you one example, and one of our panelists, Einar Bjorgo, is here. We are very proud to say that we have a very successful collaboration with UNITAR, which is called the UNOSAT, since nearly 2 decades, and perhaps we'll hear more about it. But then CERN hosts the UNOSAT's information technology infrastructure and deploys the state-of-the-art computing power, data storage, and data, which then directly feeds into the other United Nations initiatives, such as the Humanitarian Data Exchange Platform for coordination of humanitarian affairs. So indeed, we need now to be very creative. How are we going to proactively collaborate to be ahead of this curve called big data management collaboration, so that we are together able to shape better and more cohesive strategies? So I personally would say that we require a little shift in terms of policies capable of observing and identifying these trends and shifts, given the continuous acceleration of big data technological changes. And this digital age brings really a lot of collaborative software platforms, developing data management tools, which form really the basis of our research. And we need to open this to the world, to the challenges that we are looking at in terms of disease management, health data management, And we at CERN are completely open for worldwide open data services. For example, we have tools like Zenodo, which stores, retrieves, analyzes, displays, and the data is in the hands of the last mile user in our community. So yes, CERN can contribute by sharing its successful data management model, which is, of course, focused on science, technology, innovation, and education. And we would love to explore this further. Thank you.
Thank you, and thanks, Archana. We all look to CERN to set the best practices and for others to follow. So thank you so much for those comments and important points. I'm going to turn now to Kostas. And Kostas, we're looking to you for telling us more on open data policies and lessons from COVID-19. My question for you is, what good data governance practices can you share on open science policies, transparent, ethical data sharing and storage for better health outcomes? And what have you learned from the COVID-19 pandemics? Kostas, over to you for 4 minutes.
Thank you. Thank you very much, Aida. Open data as a public good is really something that it is very close to what we think for scientific knowledge as a whole. I am coming from the research and science perspective, and in the open science policy that we follow in Europe, but also others around the world, we consider that open science is about the wide and timely sharing of research outputs, actually not only data, but also software code, workflows, protocols, and so on. It's obvious that where would we be today with vaccines for coronavirus against COVID-19 if the coronavirus genome had not been deposited on day one that it was sequenced from the Chinese and Australian researchers to an open access site so that everybody could start really on day one the development of vaccines. So I come from a science policy perspective, and there is a gap there that we need to recognize between health policy and therefore health data and science policy and its own data, because there is a gap even though the data are largely the same. There are few health data I can think of that would not be research data at the same time. So coming from this perspective, I would say 3 things. That data being a public good, this means 3 things for me in terms of governance. First, that data need to be fair. Fair meaning it's an acronym: findable, accessible, interoperable, and reusable. And there are guidelines. There is a lot that has been developed on how to make data fair. Secondly, it should be open for the public in principle. In Europe, as in some other parts of the world, we use the guideline as open as possible, as close as necessary. So we recognize the need for a balance between openness of data and controlled access, for example, in order to safeguard fundamental rights or data protection or ensure security. And this is also very much along the lines of the Research G7 Research Compact that I saw mentioned in the background papers, and also the draft UNESCO recommendation that was adopted last month on open science that says that access to scientific knowledge should be as open as possible with access restrictions, proportionate and justified. The third thing, so first was fair, findable, accessible, interoperable, usable. The second, open. The third is that they should be delivered, since it's a public good, through trusted infrastructures. And the infrastructure should have a governance that is transparent, accountable, and participative. And there we should be also talking about federations of infrastructures, because as many speakers said earlier, we will not have a single mega infrastructure. Many of the data will be locally stored or nationally in national services and so on. So all this is very much compliant with what was said earlier, especially in the framework that Samira Atma gave at the beginning. But the notions of fair and of federation, I think, is something that we should think more about. Can we do this tomorrow? No, we cannot. And what are the barriers? Well, the first one is trust. And John Pulitzer said this very nicely, so I don't need to say much more. We need to incentivize and reward those who do share data that can be reused by others. So fair data. We need to do that, and equity is very important in this context. Many speakers said about it, so I don't need to say much more. The role of funders is also very important, because funders put conditions for their funding, and therefore they can incentivize. On the COVID-19 pandemic, we saw an acceleration in openness, but at the same time, this doesn't mean that now all data are open. We have a lot of data that could be open, that is closed. In Europe, we have launched, and this is the last thing I say, the European COVID-19 data platform that relies on a strong network of national centers that have been activated for quick coordination. They are the backbone of the data mobilization of the platform. And the important success of this is the launch of national portals. Not all data types of the platform are shared according to the same parameters. For example, viral sequence data are openly and widely shared, whereas the host sequence data, which requires secure data sharing, are shared through the federated European Phenome Genome Archive. I think it's a good example of governance for sensitive data that we could be looking at the WHO. It is for data that cannot be openly shared, but however, there are the mechanisms that do allow authorized researchers to access the data and to work on the data. Thank you.
Thank you, Kostas, and thank you for that balanced approach that you're taking into making open data safe and bringing trust and, of course, improving quality. And I like the federated data governance model that you alluded to. So I wish we could hear more of that, but we're running out of time. So let me now move to Anne. And from your perspective from World Economic Forum, the question is, what good practices can you share for how private sector can engage effectively with governments and civil society to strengthen data governance for better health outcome? And what ethical and legal frameworks, if you can mention, needs to be in place for data sharing? Over to you, Anne, for 4 minutes.
Absolutely. Thank you so much for having me here today. I work in the World Economic Forum Center for the Fourth Industrial Revolution in San Francisco, California. And we specifically look at issues around technology governance. I'm in the data policy platform, but we look really at how the technologies of what we call the Fourth Industrial Revolution can really be harnessed for public good, including for health outcomes, either individually or collectively. And key to that is absolutely public-private cooperation. We are the International Organization for Public-Private Cooperation, so this question is very, very close to my heart. And as everyone here knows today, at this moment in time, the power and the possibility of data use is absolutely unprecedented. The ubiquity of the collection of data, either specifically about us or all around us, it's never been seen before. And it's something that really either touches or has the potential to touch every person on Earth. So I think it's fair to say data is a really, really big deal. And of course, health data is particularly challenging because it ultimately is about people, and we have to be very careful and very sensitive to the needs of people. And in that regard, data can, of course, provide such a rich picture and insights that can perhaps even prevent disease before it takes place. We're at the stage right now where rare diseases, for example, can be researched using really interesting models such as federated learning that Kostas mentioned earlier on, and really new techniques that the private sector is really able to bring to the fore to answer your questions directly. I think one thing that's really important to note about health data is that it still is about data, and we can learn so much from what is happening elsewhere. So the private sector has absolutely such a fundamental role to play, and there are really a few different levers here that can be pulled. I think that the first one is around those techniques and those models that can come from elsewhere, and I'll talk about those frameworks in a moment. I think the second one is technology itself and the opportunity that technology brings about. For example, we are doing a body of work right now in the forum on the idea of a data intermediary. a trusted third party that can broker the relationship between a person and the technology or the AI or the research or whoever it is that is using that data, and using that data in a way that will ultimately potentially affect that person. To have an intermediary agent of some description can be a really exciting way of building that trust that's been mentioned about so often today. And how do you do that? You have an entity that's sitting in the middle that perhaps takes on some sort of fiduciary role that really ensures that the person is at the center of every decision that is made, and that there are no adverse consequences and adverse outcomes for that person. Another lever I think that's really important is the idea of investment. So data is nothing without the infrastructure, that is the computing, that is the network, whether it is 5G, whether it is a really basic piece of infrastructure. Even getting on the internet in some countries is a really big deal, and investment is not necessarily available from the public sector. So we see right across the world the importance of public-private collaboration. That is really important, because those infrastructure builders and whoever is controlling the infrastructure are able to put appropriate safeguards in place to ensure that data is secure, that systems are interoperable, and that the backbone behind health data systems is really strong. And I think the final area where the private sector really has a huge role to play is in collaborative governance. And I think you see governments really moving away from the idea of they come out with a proposal, and that proposal is perhaps, I guess, lobbied by the private sector. I think we really see, and certainly in our model in the forum, the idea that you have from the very beginning, from the inception of an idea, a really holistic approach to looking at what the potential courses of action are. And legislation and regulation doesn't necessarily have to be punitive. It can be positive. It can be supportive. We've heard a lot of talk today about incentives. We've also heard a lot of talk about the potential of making health data a public good. In order to do that, you need to have appropriate authorization, appropriate safeguards, that combination of technology, that combination of investment, and learning from what is happening elsewhere outside of the health space, because again, we are looking at data. So I think in sum to say that multi-stakeholder collaboration is absolutely essential in this area. I think it's important in all technology governance, but particularly when it comes to health, because it really does have that, that very direct impact upon people. And just a really quick expansion on the federated learning and the idea of a data trust or a data intermediary. These are very advanced techniques. These are really where we're looking at the cutting edge of research and the cutting edge of healthcare. But on a day-to-day basis, the basics of privacy, security, and just making sure that we remember that we're ultimately dealing with people is really going to be the key to success here.
Thanks, Anne, and thanks for World Economic Forum. It's really playing a critical role for bringing data and linkages with the private sector. So we really appreciate your comments and also contributions from your organization. Now I'm going to turn to Petra. I'm really eager to hear Petra on data and digital interoperability from the legal and ethical frameworks perspective. Petra, the question for you is, what good practices can you suggest for interoperability of digital technologies, and what legal and ethical frameworks need to be in place to improve data and digital governance for better health outcomes? Petra, over to you, 4 minutes. Thank you.
Thank you very much indeed. The speakers, and particularly Anne, who spoke just before me, have set me up very nicely for this. What I want to do is draw some examples from some key actions. They all come from the European Union, where I work mostly, but I want to give a few examples of where we've had some really good practices at European level and at country level on addressing the challenges both of interoperability and legal and ethical frameworks. So let me begin first with thinking about interoperability. When people talk about interoperability in digital health and in health data sharing, they tend to focus first on technical and semantic interoperability. How can we actually make data readable and usable between different platforms and different interfaces? And that's, of course, really important because if you can't read and access the data, you can't use it. And huge advances have been made recently in that field, and notably the wide adoption of the HL7 FHIR standard and the use of profile tools such as IHE, integrating the health enterprise, and the Continua design guidelines have really helped bridge that gap between pure semantic interoperability and then the interoperability with devices that might be held either by a clinical setting or even by an individual, as we have more and more individuals using their own devices, often smartphones, to collect and use data for healthcare. My personal plea would be we don't need more technical interoperability standards. We actually have plenty of them. What we need is to encourage and support their uptake and use. And I think a key tool for that is the absolutely rigorous, systematic inclusion of the requirement to comply with interoperability standards in all public procurements. It's actually shocking how much public money is still wasted, or not wasted, but is spent on buying systems that then lock data into silos. And it's not willful, it's not done intentionally. It's perhaps just that lack of real awareness of the importance of the semantic and technical interoperability standards. The Commission is doing a lot to drive that forward, the European Commission, but more can be done, and more can still be done simply in building awareness. As well as technical and semantic interoperability, we also need to think about legal and operational interoperability. And this is where we start to bleed into some of the legal and ethical issues. We still have a lot of situations where interoperability, we think only about technical. But let's take a really simple example. If you have data trying to be shared between two hospitals, and those hospitals operate either under different legal jurisdictions, national jurisdictions, or even under different policies, you may have a nurse defined differently between different settings, and a nurse may be allowed to enter data in one system and not in another. And then we immediately create a lack of interoperability, but that's based on a lack of legal interoperability. And the same thing also happens in many other levels. Now, again, the European Union has made huge advances. We have the GDPR, which is a great legal basis for sharing data and using data for public good, but it isn't quite as refined as it might be for the healthcare setting. And here we really look with great hope to the planned European health data system to overcome some of the challenges that exist in sharing data. Anne mentioned just now the role of data intermediaries. That's also foreseen within the European health data spaces, and we really look forward to those facilitating better use of data. Now, I know I'm running out of time a little bit here, but I also want to talk about something that goes way beyond anything to do with legal and technical interoperability. And it's really a very fundamental thing. It's been mentioned by several people. I want to mention it again. It's the importance of trust. If we don't build the trust, we're not going to use the data. And there are two key elements of that trust. There's trust in quality of the data, so that the scientists and the policymakers actually trust the data and use it. Again, European Commission is doing a lot there, but also the European Medicines Agency, particularly with its Darwin initiative. But we also need to do something to really build citizens and patients' trust in data so that they will make use of the data intermediaries to perhaps donate their data. And here I'd like to call out particularly three things: the work of the European Patients Forum in really growing understanding amongst citizens and patients in why data is good for public good, and in particular an initiative of the European Patients Forum called Data Saves Lives. There are iterations around it in many parts of Europe, but it's really good at building that knowledge amongst citizens. And then I'd also like to refer back to a point Kostas made, which is he called out the power of the genome phenome archiving platform on a technical basis. But I'd also like to point out that the people who are working in GPAP also work very closely with the European Rare Diseases Group in building awareness amongst patients of the value of something like the genome phenome archiving platform. So I hope I've covered the issues there as quickly as you wanted me to, and very much thank you for including me.
Thank you, and thanks, Petra. You absolutely have. And yes, Petra, thank you so much. It was absolutely great points. I really like the balance that you make on importance of the uptake and use and the link of that to trust. Now, I'm really glad to see Rocio Sanes with us, and she's the former Costa Rica Minister of Health and is currently the Professor of Health Promotion at the University of Costa Rica. And really glad that you managed to join us, Rocio. And the question that I have for you is, what are some of the data and research governance practices have you used in Costa Rica to strengthen your primary healthcare system? And are there any pilot projects that you would be considering for implementation internationally? Rocio, 4 minutes, over to you.
Thank you, and good morning, good afternoon for you, or wherever you stay today. In this part of the world, it's only 8 a.m. And thank you for the invitation. For me, it's an honor and a privilege to have the opportunity to talk to you. The first idea I want to share that it is very important to have in mind that the data, the information, the quality, the information is really a fundamental for the public health point of view. But also it's important because you are taking the information for the real life, for the people who are living really in the communities and the household, in the health services. And we need to try to, as a professional, as a minister of health, to really take decision based on the really good information. And this data has to really show the reality. And we tried as a politicians to build what is the idea, what is how the people are living, and how we can build the different programs. And for that, I would like to share that our health record or health system, we call EDUS, in Spanish is Expediente Digital en Salud, has 3 parts. And this is very important for Costa Rica. The one part is the information for the people who are living at the hospital. And we take information from the communities for the each person, for the family, and also for the life conditions before the people get sick. And this is very important. The second part of our system is really the data record. Is when the people are approaching for attention or for the health programs or for health promotion. And the other parts of the system is the entitlement, how the people has really has related from the community, geographical areas, and also to the record. And since this was really possible because every people who are born in Costa Rica, was born in Costa Rica, since the beginning has a unique number. And this number is the same number for the identification of the population as a citizenship, and also is the same number of the passport of the license for car. And for that, we have the opportunity to really to build and to share the information for the different parts of the system. In that means that we have really 3 different levels of information, from individual, family, housing, and condition of the population, and health facility. This is the micro focus. The second focus we call the meso focus. Is really they integrate the healthcare delivery networks. How we build all the information around the health services, but also the social services, last pensions, and this information is useful for research, for teaching, for how to build the health telemedicine, and for of course the data protection. And the third part is the macro focus, is the community, is the environmental. And for that, we have 3 kinds, the different issues of that. Innovation and digital information transformation. I think we have to really take in mind that the data and the digital information is really strong to bring the transformation from the health services, but not only for the health services, change the life of the people. Because it's different to have the information in the file, in the paper, and when do you have in the phone. It's totally different. You have the different information and also have to do something different. The second issue that I want to share with you is the virtualization is an optimization of the healthcare. How this transformation you improve the optimization of the healthcare. And of course, the intelligence and how build the facilities to really take all around all the people. This idea is building in 3 different aspects: innovation, research, and continuous improvement. Safety, as you mentioned before, quality, timeless, and user satisfaction. And this user satisfaction is not only the population, are also the health workers and the people who are working at the universities. And the final sustainability, efficiency, and resources optimization. This is that I want to
thank you
to talk to you.
Thank you very much, Lucia. Very, very important points from Costa Rica, and I'm glad you made it and you could talk to us on the best practices that you're recommending. Thank you. I'm going to move now to Sebastian. Sebastian, you're the Executive Director of Bioinformatics Informatics Institute at the Agency for Science, Technology and Research in Singapore, and very much engaged with GIS-AID, a genome sequencing platform that includes 180 countries supporting the fair and transparent sharing of genome sequencing of COVID-19. Our question for you is, please tell us what aspects of this work have strengthened the collaboration, sharing, and storage in data research, and what good practices could we learn from this and adopted by others to benefit? Over to you, Sebastian, for 4 minutes, please.
Yeah, thank you very much for the question. So I think there is several reasons why GISAID initiative has been so successful. And I want to emphasize that among the 180 countries or 119 countries and territories, there are a lot of low and middle income countries. And how can you be successful? How can you incentivize and convince the world to share the data and the sequences so that they can be analyzed. And I think there are three main factors. They may be trust, quality, and usefulness. All of this has been essentially said already by my colleagues and in the previous panels too. So if we talk about trust, very specifically here, it requires that data contributors know that when they share data, that their rights are protected. They want to know that they will be acknowledged and invited to collaborate for further analysis, for further research. They don't want to be left out. And that sounds a very simple system, but it's not the case in all models. And this is what sets GISAID apart from anonymous access databases, and maybe one of the reasons why it's particularly successful. The second point was quality. Quality means experts curating and close interaction with submitters for GISAID. We have hundreds of emails flying around the world back and forward. There is a close interaction and a community feeling. We are making the data better together. Quality also means completeness. That means all data is in one place, which for the public health response is a very critical aspect. It's complicated to try to create all other places to come and work together. If you have everything in one place, it is much easier. The quality also means timeliness. What we've seen here in this pandemic is real-time sharing. And in the previous panel, this has been shown, this only happens when people are confident that other people are not misusing the data, making own publications, etc. And we've come down to days of sample collection to making global access possible for these genomes. The third point and the last one was usefulness. So when people submit their data, they want to know that they can directly benefit from it. So that, for example, they can see their data in context of the other data in form of data digest, summary reports. They also want to have simple to use tools. We are striving to enable everyone to do their own analysis. And this is a very important aspect so that people can make use of their data. And consequently, this directly needs to lead to actionable insights. And these insights for genomic sequences in this pandemic is contact tracing, diagnostics, vaccines, and detecting new variants. Like Costa said, the sharing of the genome started the whole vaccines. And if you look in the data of the vaccine producers and the scientific publications, you will see which data they used, which was from the GISAID database. And it's, of course, an important aspect of the quality, experts knowing how the sequence should look like. So trust, quality, and usefulness is what may make a difference in good data sharing practice.
Thank you. Thanks a lot, Sebastian, and couldn't say it better in how you summarized it. Now I'm going to move to Einar. Einar has a very difficult job because he's the last panelist of the three panels for today's summit. But I'm sure, I'm really looking forward to hearing from him. Einar, you're the Director of Satellite Analysis and Applied Research at the United Nations Institute for Training and Research, UNITAR. The question for you is, how can GIS mapping of health services benefit health outcomes, and what good data governance practices are there for collecting, storing, and sharing and using data from GIS technologies? Over to you for 4 minutes, Einar.
Thank you so much. Just to give a little bit of background on what the UN Satellite Center is doing. Basically, we are a service entity within the United Nations system. And in that sense, we have been for many years collaborating very closely with CERN. We are based at CERN, as was previously mentioned, and we benefit really from the CERN IT infrastructure. So just want to really thank CERN for that aspect. Please keep in mind also that satellite imagery, well, it's just an image. So unless you know what you're looking at, it isn't that much to use, although some of them can be very pretty. Now, from what we are doing at UNOSAT is that we are helping, as I said, UN entities with satellite image analysis, but also at the same time developing capacity in geographic information systems to member states. So I would like to tell a story. One of the first times we sort of were, let's say, faced with a health issue. So that was in the state of Bihar many years ago, where there was a polio outbreak. And colleagues from WHO called us because they had to jump on a plane the next day. We very quickly were able to identify the very latest satellite imagery over this area, because at that time there was very poor data, poor up-to-date information about where the population was. This was also a migratory population, so having up-to-date information was very important. Now, based on that, we were able to quickly print out several satellite images, and they were literally running out the door at CERN, jumping on the plane, and the next day they had a meeting with government officials. So this is where it becomes interesting, because here you have the very local knowledge from the government official planning the vaccination campaign that they had to issue immediately. So I think, having that aspect where we really realize the interconnections with the local and the international support is very important. And today we are using these tools in many aspects. One example would be in small island development states. We have a project in the Pacific that's called Common Sensing, whereas we support Fiji, Vanuatu, and the Solomon Islands with in many aspects around climate change, etc. But we also have what we call technical backstopping. And of course, during the COVID pandemic, we were able to work very closely with the Ministry of Health, and together with them, we developed a dashboard, whereas they had totally up-to-date information about the quarantine facilities, how many people at the different quarantine facilities, as well as up-to-date information on how many people have recovered, how many people have passed away, etc. So this was, I think, a good example of what we are able to do. And here we had also the benefit of being in the country. We had one person in the country that acts as a liaison. But I think it's, in terms of good practice, it is always a two-way street. But as the UN, the street to the countries, the service to the countries should be the main street. But that at the same time, of course, we should also learn from the governments and get the feedback from our services. I would also like to say that WHO is really leading the way in the way it is supporting countries. It's probably one of the biggest users of GIS in the UN system. So all credit to WHO for really being very proactive on that. I would also say that there are all aspects to this as well. There are personal, patient level location information that needs to be covered. Of course, having information on health facilities is extremely important. When we recently analyzed the situation in Gaza, having these high-end health facilities information really helped us see, what the damage to these facilities, how close are they to the main damage points, etc. And of course, also looking at various aspects of admin boundaries, etc. So just to say that geographic information is really cross-cutting, I would say, when it comes to health. And we can discuss more, but I think my time is up. But just to say that this is, one of the fundamental aspects in order to have up-to-date information and being able to support the countries in a timely basis. Thank you.
Thanks, Einar. And such an important point. We need a summit all together for looking at the GIS aspects of importance of GIS for data storage and access for health data. So thanks for that quick 4-minute summary. Our time is up, but I'm really eager to go back to the panel. If you can bear with me for a very quick 10 seconds message from each one of you on one good data governance practice that you would suggest to the summit that can maximize health outcome. So if I can get you very quick, sort of like, a 10-second response, I would really appreciate it. Starting from you, Archana.
I'll try 10 seconds. Now that we are joining the interdisciplinary dots, the whole becomes than the parts. And that becomes very amenable for spotting correlations, midterm and long-term trends for disease and health management. At CERN, we have the tools. However, we need to customize these tools for the health sector and continue, because CERN absolutely has certification, quality control, trust, and all the things that have been mentioned. These have been a solved case with 5,000 physicists publishing together. So I think that let's work together, and data certification and its management will continue to be developed at CERN because of the challenges that we have in our science. Let's make an impact, also assessing, accessing, analyzing, anytime, anywhere, this data. Thank you.
Thank you. Over to you, Kostas, for a quick...
Thanks. Yes. So I would say look at the system of incentives and rewards for sharing. Until we sort out this, then it will always be a challenge. And secondly, adopt as principles fair, findable, accessible, interoperable, reusable, and as open as possible, and federation of infrastructures. And on the last one, EOSC, the European Open Science Cloud, that they did not have the time to talk about, could be used as a case study that could look at in the future.
Thank you, Kostas. That was not one, that was four,
Two.
but I take it.
It depends how you count. Yeah.
Anne, over to you.
Thank you. If we take it that interoperability is key and human centricity always needs to be to the fore, I think we can take it right back to basics around good data hygiene. So literally how the data is stored and tagged, that puts the data in a really good position where it can be harnessed, used, and is potentially then interoperable with other systems. And if it is appropriately tagged, it can be used. So really, really basic data hygiene.
Excellent. Petra? Your one wish.
Yeah, thank you very much. My one wish is maximum transparency. Demonstrate when and how data is used and how benefit is generated from it, because with that transparency, you'll build the trust both in its use and in donation of data. Thank you.
Amazing. Love that. Rocio, your one wish?
Thank you. Data health governance before and during the pandemic is real when it is assumed as a political public policy and is useful since the people register the information to the population. Has to be usable for all of that.
Thank you, Rocio. Sebastian?
I would recommend it just in the one sentence. Respect the rights of the data submitters from all countries in the world and enable them to make good use of their data.
Great. And Einar, again, you have the last word, my dear.
Thank you. For me, it's all about data preparedness. Wouldn't it be great if just all the health fatalities in the world could be mapped out by now?
Thank you. Thank you for this amazing, amazing panel. I really appreciate all your insights and best practices that you have offered. Now we move to the last segment of the summit, which is on future direction and closing statements. And we will start this section first with a video, which is going to share with us some of the latest work of the WHO on the World Health Data Hub, which is going to be the home of health data with lots of opportunities for partnership. So let's watch that together.
Health data represents a person, a place, an event, and it's incredibly important that we're able to bring data together at a global level to begin to understand this in aggregate. And that's where an international partner like the WHO, like Avanade with Microsoft, and the creation of the World Health Data Hub, the home for all health data, by streamlining that entire data value chain to significantly improve through the processes that we're putting in, the governance processes, the technological processes, the global health data in critical areas like completeness, timeliness, validity, relevance, reliability, accuracy, and more, to ensure that all constituents that are engaging with this data and trying to understand the pattern and the insights that it can tell us for their country, for their location, for their city, for their neighborhood, can trust it and make the decisions that we need to make from a global health perspective to protect and advance society.
And as I look at the partnership here, WHO has that trusted relationship with member states and a role as the custodian of that data. And then you combine that with the expertise from Avanade, from Microsoft on modern data governance and securing that data. And when you combine those skills and develop a platform that meets those needs, I think it really drives confidence that we can collaborate and cooperate on that data set, and it becomes a global public good that can be shared up and served back to the member states.
I would just say that big global problems require big global partnerships, public-private partnerships, like the one that we have between the WHO, Microsoft, and Avanade. And I'll tell you, structuring these partnerships in an effective way to bring something like the World Health Data Hub forward, it's not easy. There's a lot of different moving parts in each organization. And one of my personal learnings, to be very honest with you, is it takes a lot of trust building, relationship building, so that the three organizations know each other, trust each other, know where we're coming from, and can work together through the tough issues in a really transparent and effective way that we'll encounter every single day of this project. And so I hope some of the patterns that we've established here in terms of the way that we partner to do this work can be used for other areas in the area of global health and even beyond, as we work with other partners in the UN system, other partners of the WHO, to bring technology to advance social problems.
As with any good data program, we want to move away from fragmentation of data or data sitting across multiple systems and silos. Because as soon as we can pull that data into one common platform, one data lake, it's far easier to manage, to govern, and set the standards that is across all of the data that we ingest. If we don't do that, then there's always a potential for data redundancy or duplication across systems, inconsistency of standards, and maybe inconsistent classification and reporting. Anytime we see in these projects that you have manual processes, manual interventions when handling the data, there's always going to present governance and audit trail challenges. We want to make sure in future we always know where's the data come from, can that be trusted, and as Justin said before, there's a single source of the truth that everyone collaborates on and is not accessing data from disparate systems.
The World Health Data Hub is just a great example of mobilizing a public-private partnership that really builds on the unique strengths of each partner, a foundation of trust, and really the power of data and analytics to co-create a solution to solve for a global societal problem. I believe that really the best approach to data governance is pursuing a problem-driven and use case-centric approach to add real value. By being specific about the problem and the scenario we're trying to solve for, we can nurture the capabilities needed, support the change management effort, and ultimately accelerate the building of public good innovation to serve the social sector and the SDGs.
As I said before, we're trying to move away from silos of data across WHO and its partners into one consolidated system. So you're moving away from having to have systems that are interoperable, or in some cases not interoperable, which drives manual processes. Just as important is interoperability with the member states. We need to remember that states, data submitters, are providing data in many different formats, but it's a very flexible platform that is the ability to operate with whichever system or source the member state is providing. And in future, we can also look at unstructured data, social data, etc. So there really is a huge scope in future to ingest many other data sources to build a richer picture of what is going around the globe when it comes to healthcare emergencies and situations.
Thank you for that video and the work behind it in building the World Health Data Hub. And the importance of that work is really, as was said, the public-private partnership. Now we come to a very important point in our summit, and it's my pleasure to introduce to you George Simon Jurlich, who is the director of the Swiss Federal Office of Statistics. And of course, as we know, Switzerland is going to be host of the UN World Data Forum for October 2021, and looking forward to hearing George telling us about what's happening with the UN World Data Forum. Over to you, George.
Thank you very much, Saida. It's a great pleasure to be here and giving you some information about the UN World Data Forum. As you know, it's important that we work on these topics together. I mean, health is one of the very important topic in that sense. So, dear colleagues, it's really a great pleasure for me to be virtually here with you all today and to have been invited to intervene in this very important summit on health data. So I'm happy to share some information on the forthcoming United Nations World Data Forum and the ongoing Road to Bern. So Switzerland is organizing together with the UN nation the third edition of the UN World Data Forum, which will be held in Bern in Switzerland from the 3rd to the 6th October 2021, so this year's. As a reminder, the first edition of the forum was held in Cape Town, South Africa, January 2017, and the second edition took place in October 2018 in Dubai in the United Arab Emirates. Just like it has always been the case during the forum that data producers and all stakeholders who support the implementation of the 2030 Agenda will be able to meet and exchange together. As its name referred, the United Nations World Data Forum includes all countries around the world to participate to this productive dialogue and identify ways to mobilize the necessary resources for data development. So in order to really leave no one behind, we need to have everyone included because only the one counted counts in statistics. So the decision on the hybrid conduction of the forum has been taken this week by our minister, and we hope to communicate on the next step, also the next steps, the next few weeks on our website, how the hybrid conference will be conducted. So let me give you an update on the implementation of the Road to Bern. Through the program of the Road to Bern, Switzerland has discussed with many national and international partners. More than 50 events have been planned in Switzerland and all over the world. So the aim of this event are to discuss the themes of the next UN World Data Forum. Of course, health is also a very transferable theme addressed, which I don't need to emphasize how it has been lately a preoccupation for us all. It's not only since COVID, but of course, COVID helped us. And it's not only when we talk about data, that data producers and data users should come together on a platform. It's also that we start sharing our ideas. I mean, we from the statistical world have to open to people working in the healthcare sector. Maybe also there will be a statistician at the data forum later this year that we have also an exchange on that. Finally, Switzerland hopes that overall the discussions during the Road to Bern event will lead to a clear commitment, recommendations and programs that can be discussed and agreed upon the UN World Data Forum in October 2021 in Bern. There are still 3 months to go until the opening of the forum. So let us use this time to continue the discussion together in Bern to discuss the topic further that will be covered by the discussions today. So ladies and gentlemen, it will be really an absolutely great pleasure to welcome you all for the third edition of the forum here in Switzerland in October. So and thank you for having me today for this important event. And see you at the UN World Data Forum, hopefully physically and at least virtually. Thank you very much. Shall I get back to you?
Thank you. Thanks, George. And yes, we're all looking forward to the World Data Forum in Bern. And as you said, it might be, we're all praying, inshallah, that some of us will be even there in person. So see you all virtually or physically in Bern. And now we move to the next segment of closing part of our summit. And I'll give the floor to Craig Burgess, who is going to be summarizing the outcome of the summit. Easy task to do. Sorry, Craig. Craig is the lead and unit head for coordination, governance, and partnership, data analytics and delivery for impact at WHO. And he's been the prime organizer of this summit. So hats off to him for doing such an amazing job. Over to you, Craig.
Thank you, Shada, and thank you very much to all our panelists and interviewees today, really for helping make the case for data being a global public good, some of the identified country challenges and also solutions, and sharing their experiences. And most of all, thanks to all the participants today who joined in with questions. We've been taking notes of those questions and they helped shape the panels for us, but also moving forward, it helps shape our thinking too. This event, as you know, is part of a momentum for stronger health data governance, generated through a mixture of different events, such as the 74th World Health Assembly, the recent G7 communique, UN Secretary General Data Strategy, the World Bank Development Report's been referred to, and ECOSOC meetings, amongst others. We heard several common issues today, 4 of which I'd like to highlight, and they're certainly not exclusive, but 4 that I picked up are basically the need for a foundation of principles and good governance based on equity, which may or may not include conventions to address data gaps, to get the right data in the right format at the right time to the right person, whether it be to change a budget, a policy, or programs to reach communities for better health outcomes. The second message we heard quite clearly was the need for countries and communities and frontline health workers to really reduce reporting burdens and reduce fragmentation. The third key message that we picked up was really ensuring a reality check for understanding at global level what it really takes to implement data governance, especially community engagement and the data needed for disaggregated data for leaving no one behind. And then lastly, some much clearer guidance for data sharing and reuse of data using secure data storage will need some very clear ethical and legal considerations. So those were 4 main issues that came up, Shada, but we'll be writing a report in the next couple of weeks to illustrate some other examples and some other issues that came up. So what next? What we plan to do is to draft a call to action, really, for public consultation in advance of our second half day of the summit. Remember, this is 1 half day of 2 half days, and we plan for that to happen in the 3rd week of September. And the inputs for that will be guided by the inputs that we heard today, your questions, and specifically identification of specific technical themes, principles, possible solutions, and use cases that we're getting from you already. And we want to reconvene in September to engage you again to try and explore the emerging consensus on specific technical areas, on implementation and capacity building as well. Beyond September, of course, we're preparing for October UN World Health Data Forum, as we heard from George Simon. But lastly, we can't do this alone. And I think that was one of the main messages. We need very strong partnership and cooperation. We heard from all our panelists and stakeholders today, the best solutions need diverse perspectives to the right questions. Big questions need big partnerships. We hope that you can join our multi-sector approaches to govern health data better with countries and communities at the heart, including citizen science, among other multilateral partners, academia, communities, and global health initiatives. And openly working together helps build trust transparently, and trust lies at the heart of making data governance work to ensure data leads to better health outcomes where it counts the most, especially for communities left behind in fragile contexts, urban poor, rural remote, or those facing stigma and discrimination. So we welcome you to support this journey and ideally be champions for change. Thank you, Shada.
Thank you. Thanks a lot, Craig, both for the summary of the summit, but also for the way forward and what is to be expected and plans for September and October. Now, last but not least, in the closing of the summit, we turn to dear Sumia Swaminathan, who is the chief scientist of WHO, and she would be actually closing the summit for us and any closing remarks on the actions forward. Over to you, and thank you for giving me the opportunity, by the way, to moderate this summit, and looking forward to working with WHO and all the partners and stakeholders in taking this important agenda forward. Over to you, Sumia.
Thank you, Shaida. Dear friends and colleagues, first of all, on behalf of WHO, I want to thank all of you for joining today, and also many thanks to our brilliant panelists for your insights and contributions, and the wonderful discussion that we've had on health data governance. I think it's clear from everything that we've heard that the current status quo actually is an ongoing threat to global health because of the fragmentation, the gaps in health data, and the inability for us to really collaborate and use it to have the kind of impact on health outcomes that we would like. We couldn't have had a better facilitator than Shaida. So thank you, Shaida, for your being such a gracious moderator. Also for keeping everyone on time and bringing out the essence of all the discussion. So thank you. And also our thanks goes to all the interviewers and participants, because even though we've had a limited number of people participating in the panels today on the screen, there's a huge amount of work that's gone on behind the scenes. You've seen the videos, you've seen the statements from many, many stakeholders around the world. And also our country and regional offices have really helped us to put this summit together. There have been many colleagues working across the House from different departments, and particularly the science division and the data division, of course, have led this effort, but we've had our colleagues from across WHO. Everyone is committed to seeing this area of work advance. Today we've bridged, actually, when we speak about data, we've bridged, from science and research to digital technologies, and we've also been able to hear from countries, community perspectives, researcher perspectives, institutional perspectives, the private sector. And we've heard the same themes coming out. Again, there's a focus on trust, a focus on quality, the focus on the usability and utility, as well as the underlying principles and policies and practices that today, are quite varied and heterogeneous. So I think Craig has summarized also quite well, what has come out of today and where we want to go. So I don't want to repeat all of that, but I do want to say that there is a summit statement that has been drafted and that we should be posting. We would like your comments and feedback. And the statement actually will try to summarize the way forward, because we do want to get to some kind of a consensus so that we can move ahead in implementing the new policies. And this hopefully will be done by September, when we will convene again. And the intervening period, we encourage everyone to look at the statement. Please share it with your networks and colleagues. And we'd like to collect as much feedback as possible. And we will continue to have engagement with the relevant colleagues in different parts of the world. The statement basically will focus on the need or the urgency for health data governance. And we've seen in the pandemic how important it has been for open and rapid sharing of data. We've also seen the rapid acceleration of digitalization, but we've also recognized the longstanding gaps and issues which arise when we talk about data, such as, who owns the data, what's the IP rights, how is data collected, how is it stored, how is it shared, who has the rights on that data, how is it used, etc. And the statement will highlight equity as a centerpiece and the urgency to accelerate progress towards the Sustainable Development Goals. So we hope that by having such a statement that's so widely disseminated and commented upon, that this will also make sure that it's an inclusive process. And we do want to drive to some kinds of a consensus towards identifying the common principles and good practices for governing data. And we want to keep up the momentum. Thanks to many of you who shared your best practices and your experiences. Please continue to do that with us so that we can bring some very concrete solutions to the follow-up summit in September, and hopefully at that time also finalize the statement. So on behalf of Samira and I, and as well as all the colleagues who've been involved in putting this event together, I would like to thank you all very much for your collaboration, for your time, and for your active participation. And I will say goodbye till we meet again next time. Thank you so much.